blood supply to the gallbladder is from the right hepatic artery. Okay, so here we have the celiac trunk. Okay, from the celiac trunk we have the common hepatic artery, and the common hepatic artery eventually will be divided into the left and to the right hepatic artery. From the right hepatic artery we have the cystic artery, and as we notice here, the cystic artery will reach the neck or the infundibulum of the gallbladder will be divided into the anterior and the posterior cystic arteries. So here we can see the anterior and the posterior cystic arteries. Again, the common hepatic artery from the celiac trunk, the common hepatic artery to the left and to the right hepatic artery. From the right hepatic artery, we have the cystic artery, which will be divided into the anterior and posterior cystic arteries. What about the veins of the gallbladder? What drains the gallbladder blood? Okay, we have actually, in most of the cases, we have here some kind of small hepatic veins, that drains, or the cystic veins, I'm sorry, small veins from the gallbladder will get into the liver. Okay, in rare cases we have what we call the cystic vein, the large cystic vein. In these rare cases, the cystic vein will drain into the portal vein. What about the lymphatics of the gallbladder, the lymph drainage of the gallbladder? Actually, we have multiple nodes. The most prominent and the most important are some lymph nodes along the hepatic artery, as we can see here. We have other cystic lymph nodes in multiple areas. Okay, I just forgot to tell you that in most cases the cystic artery is located in an area we call the hepatocystic triangle, or what called is the triangle of Callot. Okay, the hepatocystic triangle, or the triangle of Callot, is the structure that, or the triangle that formed by the borders of the common hepatic duct. Okay, the common hepatic duct, as we can see here. Okay, and the cystic duct is the second border and the margin of the liver. So this is the triangle of Callot. Okay, or the hepatocystic triangle. Here, in most cases, we can find the cystic artery in the border of this triangle, as we can see here. Okay, what about the nerve supply of the gallbladder? Actually, the gallbladder receives parasympathetic, sympathetic, and sensory innervation. Okay, and the sympathetic and the sensory innervation is through the celiac plexus. Okay, while the parasympathetic nerve supply of the gallbladder, which is responsible for the cholinergic effect of the gallbladder, like bile secretion and the contraction of the gallbladder, is through the vagus nerve. So the vagus nerve, the parasympathetic supply of the gallbladder, which leads to contraction of the gallbladder and the bile secretion. Okay, but the sensory and the sympathetic, which is through the celiac plexus, carries the pain of the distension of the gallbladder and the bile ducts to the celiac trunk, and that is responsible of the pain we feel during the for example, the gallbladder stone. Okay, gallbladder stone. Remember that the main stimulator of the bile secretion is still the cholecystokinin. Okay, it's hormonal mainly, but the nerve supply also plays an important role in the contraction and in the secretion of the gallbladder. So this is about the blood and nerve and lymphatic supply of the gallbladder. The cystic artery from the right hepatic artery in 90% of cases. Okay, the small veins that drains into the liver from the gallbladder, and in rare cases the cystic vein. Okay, the nerve supply, which the lymphatic drainage on the nodes on the hepatic artery. Okay, And finally, the nerve supply is through the sympathetic, parasympathetic, and sensory neurons. Sympathetic and sensory is through the celiac trunk, and the parasympathetic is through the vagus, which is responsible for the contractions and secretions of the gallbladder. Thank you very much.